This time, we will talk about the pathophysiology of asthma. At the mechanistic level, what happens? Now, if you remember, asthma is a chronic inflammatory disorder of the airways. So the key word here being inflammatory, therefore, inflammation process has to be triggered. That inflammation will cause also what we call bronchoconstriction. Bronchoconstriction is that narrowing of that wonderful airway that we want. Remember, airway in, out of the airway into the lungs, make a person breathe better. Bronchoconstriction is the narrowing, bringing about that wheezing sound, the wheezing sound of somebody who has asthma. Now, it follows that the pathophysiology of the disease results from the activation of the inflammatory process. And this inflammatory process is usually triggered by an allergen. Remember in the history, the allergen is different for every person. It could be triggered by an animal dander. It could be triggered by air pollution, strong perfume, fragrance, cigarette smoke, and pollen. Whatever it is, it has to have that encounter with the allergen for the asthma symptoms to occur and manifest. Now, that introduction is not a good introduction because once that allergen is encountered by that person who has asthma, that allergen binds into the immunoglobulin E and mast cells of that person. And why is that a concern? That is a concern because mast cell, one of your granulocytes, think granules, it contains in that cell all the chemical mediators of inflammation. And with that encounter of that person with the allergen, and that allergen binding to the mast cell of that person, this mast cell degranulates and releases those chemical mediators of histamine, leukotriene, interleukin, prostaglandin. All are known to be inflammatory chemical mediators that causes inflammatory cells infiltration or accumulation in this wonderful airway, and they try to cause that narrowing of that airway through that infiltration. So if you remember, these chemical mediators, histamine, leukotriene, prostaglandin, and leukotrienes, you're going to see them again when we talk about treatment. That inflammatory process and that release of this chemical mediation, like I said, releases in that two pathophysiologic process, the bronchoconstriction and the infiltration of the inflammatory cells that narrows the airway because of the swelling and edema and mucus production that it causes. So in summary, that process, that introduction of the allergen, the binding to the individual mast cell and IgE results in bronchoconstriction and infiltration or collection of those leukocytes, eosinophils, and macrophages that results in swelling and mucus production. That's the pathophysiology of asthma.